Hi, I'm with Sarah Tempest and her daughter Zoe. I have seen Sarah since the time that she was pregnant. So just before she had the baby, she and I had a session together where I explained to her the sorts of things that she would need to know about before she had the baby. And then over successive months after the delivery of Zoe, I've caught up with Sarah at different times. And Sarah's agreed to have a chat and tell me about her experience from her side. Thanks for chatting with me, Sarah.
No problem. Happy to.
So tell me, how did you, in the beginning, how did you connect with me? What you to me?
So I saw a really fantastic obstetrician who referred me to you, as well as some other different experts for different things, than what you did. And I was really grateful for that, because I don't think I would have actually sought out a lactation consultant independently. You don't know what you don't know. And so it was really great to see you, because while he talked me through the birthing side of things and from a medical standpoint in terms of keeping me and Zoe safe, what you did in that first consultation was talk me through what she's going to do when she arrives into the world, in terms of, bobbing about on me and how she would act, and it was spot on exactly what she did.
Fabulous.
And that was just really good to know what was going to happen and what that meant when she started to do that, and what I should do in that scenario.
Yes.
So I 100% would say to people, well, see a lactation consultant, but have your first consult before the child is born.
Great.
That was really important for me.
Well, we certainly know that first hour of skin-to-skin contact with mother and baby makes such a difference to the long-term outcomes of breastfeeding.
Yeah.
So then, tell me, it's always nice to hear that that people have been helpful and that I've been helpful to you, but what else would you say about our times together?
Yeah, well, you raised the skin-to-skin, and again, that was a concept that I learnt from you. And I think it was incredibly beneficial to my husband and I. So I had a cesarean, and Zoe was on Nathan's chest straight away, and for the first, however long I was in recovery for, the first hour, and then she came to me, and a lot of people do skin to skin, but the different thing that I learnt from you was about if you can do skin to skin exclusively for the parents for the first 48 hours, then that's going to be really beneficial. Bar the medical staff, of course.
Yeah.
Now that's obviously a really hard thing to implement when there are really excited grandparents around.
Yes.
And I think my mother-in-law thought I was joking when I said this, and my mother could hardly contain herself when she was in the hospital. But we did it, and Zoe has this amazing relationship with Nathan. She will light up when he comes into a room. I speak to so many mums who say their husbands can't settle their baby, can't put their baby to sleep. Whereas I think she loves Nathan more than me. We don't have that issue at all. And, I'll never know if it's because of that skin to skin.
Sure.
We can't ask her.
No.
But it certainly hasn't hurt. So,
No.
why not give it a crack?
Absolutely.
Yeah.
Yes. So I saw you, I think I must have seen you in the first couple of weeks after you'd had the baby.
Yes.
Too. And we just checked on how your attachment was going and how the feeding was going.
Yeah.
So in terms of when you suggest to someone when they might have a lactation consultant, if you could actually have your friends sign up and do it, what would you tell them to do that you felt was invaluable?
First of all, see one. I think there is so much so much differing information out there from all sorts of different sources, from other mums, from midwives at the hospital, doctors, then when you're out of the hospital with the local child health clinic.
Yep.
And everyone says different things, and it can be really overwhelming and really confusing to know what is the right thing to do. So the fact that I was introduced to you meant that I could say, okay, when it comes to feeding, I don't listen to anyone but Lynne. Lynne is my single source of truth, and I just shut out the advice from everyone else because it's too hard otherwise.
Yeah.
And you second guess yourself and you don't know whether you're doing the right thing. And obviously it's important to find someone you trust, but I felt like I trusted you from day one where feeding was concerned. And so I was quite happy to put, all my faith in doing what you said was the right thing to do.
Great. It certainly worked anyway, didn't it?
It absolutely worked.
It was a dream in terms of how she fed and settled.
Yeah, absolutely. Yeah. And look at her, she's a picture of health. She's a little boomba.
You are not fading away, sweet pea.
The other funny thing is that, people, I think there's this misconception that if you exclusively breastfeed, they're not getting enough milk and they're hungry and whatever. And, a couple of times when I was in mothers' rooms, just in shopping centres, people would say to me, because she's always been a good size, and people would say, "Oh, are you just breastfeeding? Do you give her a formula bottle as well?" I said, no, exclusively breastfeeding. And they're really quite taken back that a baby can look this healthy and be this big and be exclusively breastfed.
Yeah.
It was really interesting.
Yes.
Yeah.
Did you have a lot of pressure from friends at different times to get onto formula?
I actually don't have a lot of friends with babies, but there were a couple of older women who would say, "Oh, why don't you just give her a bottle?" And there absolutely is that around, definitely.
Yeah.
Yeah.
So how did you, it was probably a lot different to what you expected. What has been your goal as a mother? What have you taken on motherhood?
Yeah.
And what did you feel about the breastfeeding?
I think knowledge is power, and I really didn't have much of an appreciation before I started reading and seeing you and things like that about just how beneficial breastfeeding is, because I can remember during my pregnancy, I remember having a conversation with my mum, and I'm actually polycystic. And I know that you can have breastfeeding issues when you're polycystic. And I remember saying to my mum, about halfway through my pregnancy, I might not be able to breastfeed. And you know what? I'm not going to stress myself out about it. If that's the case, that's fine. She'll just have formula, no issue. And then my view on that really started to change the more and more reading I did about it. And I thought, oh, no, hang on. The science is very clear.
Yep, sure is.
And, all parents want to do the best thing for their child. So I thought, if I can, I'm absolutely going to do this. And I'm going to do it exclusively because I've got the milk there. I've got good support. For me, I felt that doing a combination of breast and formula, I felt I would be selfish to Zoe because I'm not at work. This is my job for the next 12 months.
Right.
I can breastfeed her. Why would I not do that exclusively? Yes, a combination feed gives you the freedom. You can leave your child with someone else in those early days. But we make so many sacrifices when we're pregnant to do the right thing for this little creature growing inside us. Why don't we extend that for the first 6 or 12 months of their life? Why do we think differently when they're out?
It's true.
I don't judge anyone, but that's certainly the way I thought about it with her.
Yeah, I think that's I think that's a very reasonable approach because, as you say, you'll go off alcohol. Often girls will go into really strict diets in terms of looking after themselves. Some will even go organic, and yet quite happy to then use formula at some point with their babies, in spite of the fact actually that most of them feed very successfully and really don't need formula. So, and can I guess now, because we're almost finished in terms of you won't need me much more except for your next one, is was it an onerous cost for you? Was it something that you had to think twice about in terms of having well, me because I
Yeah.
saw you, but having someone come in privately as frequently as we did catch up?
Look, I absolutely know that I'm fortunate in that regard, that it wasn't something I had to think twice about, but I appreciate that not everyone is in that position. But I do think I would encourage people to think hard when they're doing their baby budget, and you've got the list and you've got the pram and you've got the cot and you've got the change table. Have lactation consultant on your baby budget list. And because it's so important, this is the food that you're putting inside them. Forget the $2,000 French cot, you know, buy the $300 one and see a lactation consultant.
Right. Well,
I wouldn't think people would regret that spend.
That's wonderful. I must say, as part of what I do is when I see people antenatally, is I try and reduce the cost of the things that they do buy. Because there's so many things there, as you know, you go into the baby shop and it's not about what you need. It's about, wow, we've got two unsuspecting people here. Let's just help them part with the money.
Yeah, and that's exactly what happens.
Yeah, that's true.
Yeah.
So, yes, I feel that's very reasonable, because I think with what you save on some of the things that you never use, and often they're just a one-off thing that you'll never get your money back on.
Yeah, definitely.
Whereas, as you say, you've got something that that you're doing that's very worthwhile for your daughter.
And certainly, if you have private health insurance, you know, I know that my private health insurance covered a large portion of
that's good.
seeing you.
I know that they vary so much with what they offer, and I often say that, because I don't keep in touch with what the funds do and how they change, that really, and I don't mean it to be a throwaway comment, but sometimes I just say, look, you know, if you get enough to get you and your partner a cup of coffee after it, I just hope that you see the value of it rather than being too concerned about what you're not getting back.
Yeah.
So,
no, that's true.
Well, look at Zoe as a result of all that breastfeeding.
Yeah.
She has done incredibly well.
She has.
And look at you, you're slim, trim, taut and terrific, so it's helped you lose all your baby weight.
Well, they do say it helps.
Absolutely.
And I haven't done a lot because it's busy time.
Absolutely.
There's lots going on.
No, it's not a lot of time for mums.
No, there isn't a lot of time for going to the gym and working out. And,
breastfeeding will do it all.
I think it has to have helped.
Yes. Sarah, thank you, and I'm really hopeful that will help parents considering breastfeeding.
Yeah,
thank you very much.
No problem.